What's up, everybody? Glenn Colillo from Catch Healthy Habit Cafe. Just want to thank everybody for the emails and the texts and all that stuff reaching out based on my Facebook Live post from yesterday, Thursday, March 29th. I was at Valley Sports Physicians and Orthopedic Medicine in Glastonbury, and a long time thinking and studying about stem cell treatment. Yesterday was my appointment and the therapy was done. So I want to talk a little bit more about that, but I just want to back up a little bit and give everybody the whole picture. So the whole picture is this. Some time ago, early in 2017, I went and got x-rays on my hips. Now the reason for that is just completely, totally tight hips, having trouble with range of motion. Playing tennis was abomination, but running 5 miles, you wouldn't know any issues. So over time, I just kept thinking, this range of motion thing is really starting to bother me. Let me figure out what there is to do. So went and got the x-rays, and the conventional doctor, great guy, basically came back, there's other than double hip replacement, there's nothing else. There's nothing else we have in medicine that can help you. I won't even get into the question about diet and supplementation to help the hips and the response. I'll just you can all figure that out. So it was double hip replacement. So I sat on that probably since winter of 2017 when the x-rays took place. Tried to do some things on my own, and a little bit better. I would say the number one player in slight improvement was the mega dosing of silica. So I was doing some silica, liquid version of it, and I in range of motion or lack of range of motion in the scale of 1 to 10, if I had a 9.5, I would have said I went down to about an 8.5. But I wasn't really gonna just stick with the silica and stretching and see what happened from there. So kind of came across a few different options for stem cells. Obviously, some of the therapies are illegal in the United States, but great success, as well as what they are doing in the United States, also having good success. So study, found the Valley Sports Physician in orthopedic medicine. Now you can find them at JOCK doctors.com. So that's where I met Doc Paul. I'm going to just get his name up so I don't butcher it too much. But Dr. Paul Tortlin. So in meeting Dr. Paul Tortlin and kind of doing the initial appointment, he told me all I needed to know about the different regenerative therapies that they offered there. And again, took that home, did some therapy, and at that point, the call back to him was to agree upon doing PRP, which I'll get to in a little bit. So as we got really to the appointment, maybe the day before the appointment, I just kind of reached out and said, listen, I think I'm going to do this stem cell thing. So, which is obviously more expensive, and I'll get into that too, but I went with it. I figured I'm going in there, I'm doing a treatment, and the only thing different for stem cells is a little bit more time and obviously harvesting the stem cells, which again, I'll get into in a little bit. But so I did the whole therapy. What I did was, and I'll go through them step by step. After the initial appointment and the decision to go forward with the PRP, I went in on Tuesday and did prolotherapy. So the Tuesday is a prolotherapy, which is the setup for either the PRP or the stem cells. So let me just read you a little bit about prolotherapy. But again, you can find this in jockdoctors.com under services, regenerative medicine. So prolotherapy, also known as regenerative injection therapy is an injection technique used to treat chronic pain related to damage to underlying ligaments or tendon structure. It involves injecting a small amount of mixture of Novocaine, dextrose, which is sugar, which I don't love, but we're going to get into that pretty deep in a second as well, or other similar solution directly at the site of the damage. The sugar stimulates the body's natural healing and repair processes. So it goes into a lot more. I'm seeing the word Hippocrates and things like that in the further description, but that was part of what needed to be done. So that was done on Tuesday. Really pretty simple. It was really just a shot or just an injection. Pretty painless if you're okay with needles, which I am. So then come home on Tuesday and get ready to go back on Thursday, still doing PRP. And the decision was made basically on Wednesday to say, hey, let's do the stem cells. So I just called to make sure the appointment was available to stay in there a little longer with Dr. Paul and go forth, and it was. So stem cell happened, but let's first talk a little bit about PRP and what PRP is. So the early part of yesterday's appointment, Thursday's appointment, which was 2 days after the Prolo injection, first was the PRP, followed by the stem cells. So the PRP is, again, just pretty simple injection and a little bit about what it is, but in detail, the website is tremendous informationally, so you can go to jockdoctors.com and read more. But what is PRP? Maybe the acronym for PRP is unfamiliar to you. It is one of the newer sports injury treatments. We work with patients throughout New England and the Northeast and beyond by using PRP as one of our treatments. Our doctors are experts at using these treatments, and you can get relief from your sports injury fast. So more about PRP. PRP, or platelet-rich plasma, is a revolutionary new treatment for chronic sports and musculoskeletal injuries that is taking the sports medicine and orthopedic community by storm. Professional and recreational athletes alike credit PRP treatment for enabling them to get back in the game, and patients with joint arthritis are experiencing less pain and greater function. So Valley Sports Physicians has been performing PRP treatments since December of 2007, making them among the first and most experienced physicians in the country offering these treatments. Few practices in the country have their level of skill and expertise. I'm going to go on just because this is pretty important to really understanding why this preceded the stem cells. So platelets are a specialized type of blood cell. Blood is made up of 93% red blood cells, 6% platelets, 1% white blood cells, and plasma. The goal of PRP is to maximize the number or concentration of platelets while minimizing the number of red blood cells. Generally speaking, the higher the concentration of platelets, the better. So needless to say, my blood, when it was taken, they kind of just check and make sure you've got the platelets and all the right counts to go forth, and I was pretty strong in all their measuring sticks. So blood was taken, and again, in the Facebook Live from the other day, you can actually see how much blood they took. They took a lot of blood. So anyways, that was all set. So the PRP took place, and again, nothing crazy, just basically shot, just an injection. Then that's when everything kind of got fun. So there's a little bit of time in between them doing some work with some of that blood to also get ready. So the PRP is done, shots have taken place, and now it's time for the stem cells. So let's talk about this. There's lots of confusion out there about stem cells, and there's great podcasts, and I'll try to list those in the bio of this video. But so there's all the issues with stem cells and the bad press and the craziness and they can't do it. It's against all these principles. That really is about embryonic stem cells. So this is at no means anything near embryonic. These stem cells are actually coming from deep inside my body, my hip cavity, we'll call it. So it's my stem cells harvested from my body, then treated in some way, shape, or form, and I'll explain that a little bit. But again, jackdoctors.com, all this information is thoroughly spelled out. So the stem cells get treated and then re-injected. So the harvesting was really the issue for me and the big struggle. So anyways, I'm fine, walking, I'm upright. I'm supposed to do some light stretching to keep the hip cavity kind of moving and everything flowing. But let's backtrack a little bit and read a little bit about stem cells and the type of stem cells therapy that was done to me, and maybe understand why. So again, this will be a little bit longer, but just stay with me, because you need to, or it helps to understand all this information first. But stick with me, because you want to know how the stem cells were harvested. It wasn't necessarily a pretty picture, as my wife Lisa sat there and watched, and I passed out. So here we go. Valley Sports Physician is a national leader and pioneer in the use of stem cell injections for orthopedic and musculoskeletal conditions. So they began bone marrow-derived stem cell treatments in 2008 and fat-derived stem cell treatments in 2009. Now again, mine was a bone marrow, hence the going into the hip cavity and harvesting out of that. One of the main reasons for that is the fat-derived stem cells. We need a little bit more fat than I presently have to really get a good amount of stem cells. So the uniqueness of stem cells. Stem cells have several unique abilities. They can transform into other cell types such as bone, cartilage, muscle, and tendon, and they also serve an important signaling function, recruiting other stem cells to target the area, triggering nearby cells to begin the repair process. Some of the conditions Valley Sports Physician typically use stem cells for or recommend, obviously osteoarthritis, chronic partial rotator cuff, persistent partial tendon tears, tennis elbow, plantar fasciitis, partial muscle tears, cartilage tears in the knee, and a couple other things here. So in talking to Dr. Paul about my hips and my range of motion, he was at no time ever saying that you do this treatment and you'll be playing tennis with, the stars soon, or the pros. He wasn't saying that this was necessarily going to work. He did say it ain't going to hurt. The only thing it's going to hurt is your pocketbook. But my mindset was, hey, I'm not going to do the replacement of the hips, at least anytime soon. So why not give this a shot? There's plenty of people online, podcasts that are talking positively about this. I've known some local friends that have done some various stem cell treatments in shoulders and in different things. Every single one of them, well, not a lot, 6 of them personally that I have talked about, have all had success. Some of them ecstatic success, others saying they would do it again. So basically nobody's saying, hey, I paid this money and this treatment did zero or nothing for me and I would not recommend it. So everybody was positive with the results they got. So let's talk about the harvesting, which was a lot tougher than I anticipated on my emotional state. So basically what happens, they set you up, they do some deep Novocaine into the hip cavity that they're going to harvest. So that had some pain points to it as the needle got a little deeper. It was like a nice, if somebody kind of really gives you a pinch and it's annoying and then they keep doing it really hard, and you want to punch them in the face, that's kind of what this felt like. But it was short and it was quick. So now the harvesting comes, and again, Lisa was too freaked out to take any pictures. And obviously I'm laying face down, so I'm not seeing it. But I'll tell you what I felt. I felt a tool go into my kind of low back, upper hip cavity. And then the whole time, Dr. Tortlin is definitely telling you exactly what he does and exactly what to expect, and exactly what he said is what happened. So that was kind of comforting. That would be comforting to other people that are gonna do this, knowing if you do what Dr. Tortlin, he's right on task. He's been doing it for a long time. So the tapping started. So they got to go in pretty deep into that cavity, into that bone, in order to extract the bone marrow. So the tapping is happening. And again, I'm Novocaine, so there's no pain here. There's just a lot of issues I'm having in my head, with the point of having this tool in my body and somebody outside of my body tapping it deeper. So it got challenging. It got really challenging. The deeper he went, to the point where I don't know that I said stop, or I just said I think I'm going to faint. And at that point, according to Lisa, I did faint, and almost instantaneously went into a snore, which I guess was probably comforting to Lisa because I was alive. But so that happened. So, and it was a little scary on my point. I mean, I don't want to say it felt like I was going to die, but when you know you're going to pass out and hit the ground, in this case, obviously I wasn't going to hit the ground, but it's a little scary, and it was scary. So I came through, and the whole time I came through, when I started talking, it was pretty much close to the end of that particular procedure. So that was comforting, and that's when Dr. Paul kind of talked me a little bit more through it, and I know Lisa was there. So that was over. Stem cells were harvested. So upon the stem cells being harvested, they disappear a little bit. They do what they have to do in the procedure to set the stem cells up for injection, and then that happened a little bit later. Stem cells were in. I was done, and this is where the most interesting part of the procedure happened. So the procedure is now over. So it actually wasn't part of the procedure. It was me. Like I lost it in the sake that I just wanted to cry. And I actually did cry when everybody else left the room. But I wanted to cry during the tapping. I really did. I wanted to cry during the tapping. And I held it back. You know, and I got to get into why I held it back, because it wasn't a pain thing. And I was telling Dr. Paul that whole time, there's no pain here. It's just something going on that's a little weird for me right now, and I had to process that. So when everybody left, I lost it. Like Lisa had mentioned, when somebody came back in and asked if everything's okay, she's like, yeah, he's all right. He's just having a little bit of a meltdown, and that's a good phrase for what was happening. But what was it? Like, did going into the hip allow some things to come out? Do you hold on to a lot of stuff in your hips? I think so. I've kind of remember hearing that previously, always talking about my hips and range of motion and how bad my hips are, blah, blah, blah. Certain spiritual people would say, you hold on to a lot in your hips. So maybe when these tools were in me and the tapping was happening, that stuff just wanted to come out. And it did. It came out. I restrained it a bit. Hopefully didn't send it back into the hips, but I did let some of it out. And I'm going to continue to research that a little bit. So that's what happened. That's the end of the therapy. I went home. Lisa drove home. And post-therapy, super stiff. Very little pain. But again, Dr. Paul's a conventional doctor. So he set me up with painkillers. So it's take 1 to 2 tablets needed up to 4 times a day for post-procedure pain. Now again, back in 1989, I did have back surgery and I did experience severe pain. And ever since then, when people ask about pain, I compare it to that. So there's no pain. I don't have any pain. I've got stiffness. I'm not comfortable. Trying to move, get into, and get out of bed is a slow, grinding process. But I wouldn't call it pain. But with that being said, to ease Lisa's mind and also just to take one before going to bed, hoping not to wake up in the middle of the night in pain. I did take one last night, and I did take one this morning. I don't know if it helped. It might have helped a little bit, but I did. But what it didn't help with was constipation. So now I've been constipated today, haven't eaten anything, have taken some charcoal. I'm not so sure if that was the right thing to do with the stem cells and some of the stuff in me, but I got to move. And by not moving, my back is starting to really tighten up and feel pretty sore. So we're hoping for some movement pretty soon. But in the meantime, things feel good. According to Dr. Paul, 3-4 days of really no extracurricular activity other than walking and some hip cavity loosening stuff, moving the legs and the hips around a little bit to keep flow in there. But that's basically it. So that's Tuesday with the Prolozone, Thursday with the PRP and the stem cell. Again, it's March of 2018. We'll see how the range of motion gets better. We'll see what else happens with all this stuff inside my body now. And I'll be back to kind of report on that. But in the meantime, he said the stem cells, you're really not going to be able to take that number down as far as range of motion. Right now, my range of motion, 8.5. It's probably obviously way off the charts as no range of motion now because of the therapies. But he said you won't really be taking that 8.5. You'll get back to that 8.5, but you won't be taking that down at least for 3-4 weeks, even maybe a month and a half. So we'll keep you up to date with much shorter pops on Instagram and maybe Facebook Live and all that stuff. But that's the video for today. And thanks for checking in. Thanks for listening. Again, Jock with a J, jockdoctors.com. They're located in Glastonbury, Connecticut. Dr. Paul Tortlin and the nurses there, all phenomenal people. And so I'm glad at this point that I did it and it's done. I just hope to reap the benefits. Oh, I didn't mention anything about the cost. So the PRP was basically going to cost in the vicinity of $900, and you're set up to do more than one PRPs. Even with the stem cells, I'm going to go back and get a PRP the end of April, and that's supposed to kind of be fertilizer for what has gone into my body over the past couple days. So the PRP session for the end of April will hopefully keep everything moving and going in the right direction. But if I just did PRP, it was I was going to get a PRP this past Thursday in March, late March, another one in late April, and then one in May, and then one 8 to 12 months from then. With the stem cells, now that stem cells in, I'm going to follow up in late April with the more PRP, and then 6, 8, 12 months we see what's going on, and then I follow up again with possibly another PRP treatment. So the stem cells, the PRP, the whole wagon everything that was in the wagon yesterday that I did was pretty in the vicinity of 5,000 and change. So that was the investment that I made in myself, and I'm looking forward to that investing, reaping some benefits in my range of motion and just my life. I mean, I love to play a little bit of basketball, love to play tennis with Lisa and her family, and just not look like a 92-year-old man not able to move. So that's kind of why I did it, and I'm happy I did it right now. Again, we'll follow up with the benefits. So thanks for checking in, and thanks for listening.